everybody, we have 3 systems that all work together so that we all have good balance no matter what age you are. So we have our balance organ, which is our vestibular system in our inner ear. We have our leg strength. And then we also have our visual component, which we rely heavily on when something else is not working properly. The younger population, it's a little bit different as far as balance is concerned. The biggest thing are just sports injuries. We see a lot of high schoolers, middle schoolers with sports injuries, and lots of kids are participating in sports year-round these days. When you have an injury from playing sports, whether it's an ankle sprain or like a tear in your ACL, not only are your muscles around the joint weakened after that because you kind of lean off to the other side or you're compensating for that injury. The other issue is that besides the decreased strength, if you have any kind of ligament issues, you're losing that stability of the joint because the ligaments attach from bone to bone. So for instance, if you have an ankle sprain, you roll your foot inwards, let's just say, those ligaments kind of get a little overstretched, and especially if you're more prone to ankle sprains, the more you sprain something or overstretch some ligaments and tendons, the more you're going to be at risk for having further injuries. So we want to assess that as soon as possible so that you can have the correct injury management to prevent further injuries. We want to properly address the weaknesses of the core, and that is a very big thing these days, especially with young girl athletes. So, it's one thing if you're, a swimmer and you're really working on those shoulders, or you're a gymnast and you just are working a lot of power in your legs. But the thing is if you don't have what we call proximal stability, which is your core, which is your abs, your pelvis, your hips, if you don't have that, then anything away from the core can be easily affected and injured. Your core is your stable area of your body, and anything that kind of stems from that, you're more at risk for injury if that's not strong. With physical therapy, we treat a lot of sports injuries, whether you're in middle school or high school or doing some recreational activities. We'll be able to educate you on injury prevention. We'll be able to give you that education on your injury that you're having and make sure that you're able to return to sport and properly progress your exercises to prevent the re-injury. That's a huge thing. A lot of times people get a sprain and then they kind of rest for a few days and it feels better so that they return to the sport, but then the problem is they don't realize how weak they've become because they haven't really done the activity in a while, and then you're more at risk for re-injury. So give us a call or click the link below if you would like some more information or an assessment of an injury, whether you're in the 55 and older population or a younger population and you're wanting to learn more about balance.